So this is a video for our patients that need help when they've got what we call a fat pad dysfunction, and that's basically, and they usually present with pain in this kind of distribution, typically around here, and it's very sore and tender in there. Okay, so what we need to do is just practice. There's 3 taping methods. This is the first and most successful one, and we're going to show you how to do it so you can do it at home. We recommend that you do this regularly while you're having treatment and while the fat pad is still an issue, especially during if you're going to be running or playing sport. So the key factors with this is making sure, one, that your quadricep muscles are relaxed, because otherwise the kneecap won't move enough. So if you tense your muscle for me and watch as I try and move the kneecap, I can't do anything. So then relax, re-relax, and instantly I get much more movement. So that's what you want to be taping on, otherwise you won't get any movement. Now typically what we see is that because of the kneecap often being pulled over this way because of tight structures, biomechanics, etc., what we need to do is just do the complete opposite and just give it a little bit of support over to that side. And then what that does is it just offloads this sensitive area, helps with biomechanics, and typically just helps stop that pinching effect, and it really helps calm down the inflamed area. Okay, so we'll do a tape now. So you need 2 strips about this kind of length, and we're taping from lateral to medial. Okay, so I'm going to just tear off here, and you want to leave a good inch and a bit of no pressure on, no stretch. Okay, so I'm going to start. So I've got my kneecap, which is here and here. So I'm going to start just towards the top end of it. So I'm going to start here, and then this bit goes on. I'm not putting any stretch on there. That's just like an anchor, what we call an anchor. Okay, then I'll peel off this bit, and I'll leave another anchor there. Okay, so in this position there, making sure your quads are switched off. And see how I'm just pushing on the kneecap there, and I'm putting on a fair bit of stretch, about 60% or so. And as I come over, keeping that pressure on there, taping down, and then the pressure comes off, and I'll just anchor down there. Okay, good. And what people tend to do as a mistake is they overstretch it. You know, 50% stretch, maybe 60 is all you need really. If you start doing all of the stretch, it just gets uncomfortable. So you can do exactly the same. So here, and this one, because we've done the top side of the patella, I'm going to just get just this bit here now. Okay, so we just overlap slightly again. So just overlap slightly. Bring that one there. That's my anchor. Try not to touch the tape. Bit of stretch, bit of pressure with my fingers. Coming over, bringing that kneecap over. And here's the other little tip that we often recommend, is just ending that one off by just moving upwards like that, and it tends to just lock it in a bit more securely. So if we have a look at that bit there, just to show how it's gone up like that. Okay, and then just relax, and then that's all done. Okay. So this is an alternative for people who don't get on with the McConnell's one. This is like a sling technique. So basically, if you've got that fat pad inflammation, we want to stop the kneecap doing some microtrauma to it. So a nice way of doing it is you can actually lift the kneecap up slightly, and then you get this wrinkling effect here. So it's just basically lifting it off and stopping the impingement. So what we do for this one is, it's quite a simple one, but it needs to be done in certain areas. So you need to have at least 30-degree flexion of the knee. So I've put a pillow underneath the knee to give it that kind of flexion. And what I'm going to do with this one is I'll just tear it in the middle, and then you leave the anchor on the end. Again, anchor on the end there. Okay, so then I've got these 2 bits here, and I can put a little bit of stretch on. But not this one. I've found that actually you don't want to put anything more than like 40% stretch, really, maybe 50 max. Otherwise, it gets a little bit uncomfortable. So really try and relax as much as possible. You don't get as much movement because you're in flexion and the kneecap's in the groove. But all we care about is that lifting effect with this one. Okay, so bit of stretch on there. So that's nothing. About that much there. I'm going to go around the kneecap like that, and like a sling effect there. Okay, And then I just finish off up here with your kind of no stretch. Again, up here with no stretch. So you've got that. So you've got the kneecap sitting in this kind of hammock or sling or something like that. And just make sure it's all stuck on. You will get a little bit of crinkling there, but that's all right. That's fine. Okay, and then what we'll do now is we'll just keep it on from it, and what I'm going to do is move the pillow out of the way, and then you relax your knee. Okay, and then you just get this kind of lifting, crinkling effect, and it just gets a little bit more squidgy. So what happens is that is just lifting the kneecap off the inflamed area. Okay, and if you give me the video, if you ever stand up for me, and just have a look what it's like in standing. And in standing, typically you see that it's a lot more lifted, and that's obviously what matters because it's functional. Okay, and you can see all the crinkling here. That's what you should have. Okay. So this is the last taping method, which often really helps and is quite easy to do yourself. And it's a one where you just kind of encase the kneecap in both directions. Again, you need a pillow underneath your knee for 30 degrees of flexion, okay? So this one's quite a nice simple one. It's just tearing in there, like this. And the anchor. And the anchor there. So I've got this bit here which I'm going to be stretching. And I've got my kneecap here. Alright, so when I'm there, like that, put it on about 50%, and I come around the kneecap like this, and I come around the kneecap like that as well, and I finish off with no stretch. Keep that on, and then what we do is you've got 2 strips with this one, same size again, exactly the same technique but on the other side. So tearing there, anchor there, anchor there. Okay, so again, stretching there, and I'm just going to come around to this side of the kneecap there, that side of the kneecap there. Just finish off, no stretch again, so you get this kind of effect where basically what happens when we straighten your knee, you'll get this wrinkly kneecap, and that's lifted the patella off, and it will stop that inflammation again. So we'll just have a look at what it looks like when we relax you down. Okay, so you can see quite a nice wrinkle effect there, which is exactly what you want. Okay.